Thanks for joining our Nursing Career Chat today. I'm Andre Luck, Pvcc's Career Services Manager, and today's spotlight features Leanne Davis. She is a registered nurse at UVA Health and adjunct faculty at Pvcc. You will have a chance to ask questions by using the chat feature below, and this conversation is being recorded and will be posted on the Pvcc Career Services YouTube page. Welcome, Leanne.
Thank you.
Leanne, have you always wanted to be a nurse?
For as long as I can remember, yes.
Wow. So just as a girl growing up, what was it about nursing that intrigued you?
I've always been really interested in the human body and the things it can do. Also the way different interventions and medications can alter that. When I was a kid, I watched a lot of ER shows and labor and delivery shows, and totally disgusted my whole family. They would walk in and say, "Oh my God, she's watching that stuff again, turn it off." I had a grandmother who was a CNA, and so hearing some of her stories about caring for patients has just always really interested me. And I love people. I love working with people and helping them. So nursing just seemed like the right thing to do.
Oh, great. Well, there are so many different types of nursing, practical nursing, and then nurses with an ASN, a BSN, and MSN. What are the differences or the different types of nursing?
So LPNs, the program you go through to become an LPN is a certificate program. So you don't graduate from that program with a degree, a certificate. Most of the time, those nurses are employed in long-term care facilities or clinic facilities, but it's a great way to get started in nursing. You get to work as a nurse much faster when you go through an LPN program than any of the other programs, which take much longer. The associate's degree nurse, this is like if you go to Piedmont and you graduate from there, you graduate with an associate's degree in nursing, and you can sit for your state board to be an RN. And that's like an entry level nursing degree. They work in any facility, really. You could do long-term care as an associate's degree nurse. You can work in a hospital setting, in acute care or intensive care. You can work in a clinic. But that's the entry-level registered nurse degree. Most hospitals nowadays require you to either start with a BSN or sign a contract saying that you'll get a BSN within 5 years. That's what I had to do. When I started at UVA, I was their first, in their first cohort of new nurses who signed the contract saying that within a year we would start a BSN program, and within 5 years we would complete a BSN program. The BSN part is a lot of leadership and administrative type things. You don't really learn anything that changes your nursing practice. It just builds upon your nursing practice. A lot of teamwork stuff and leadership. The MSN is usually more specific to an area that you enjoy. So let's say you go to work as a nurse and you have a BSN, and like myself, you find out that you really like to teach, you like to educate people. Then you could go back to school to become an MSN. And so my MSN is in nursing education. As an MSN, you could also do a number of other things. There's anesthesia, nurse practitioners have master's degrees, midwives, all kinds of things you can do as an MSN. And then there's also PhD and DNP, which are the terminal degrees in nursing. PhD is more research-based, and then the DNP is more practice.
I know there are a lot of healthcare facilities, especially doctor's offices, that are hiring nurse practitioners to take the place of doctors. Can you tell us why?
I think they cost a lot less. There's also, if you look at the time it takes a doctor to finish med school and then like a family medicine residency, that's a long time. A nurse with a BSN can go back to school and within 2 or 3 years become a nurse practitioner. So I think it's a quicker way to kind of fill in all the holes in primary care. There's definitely a shortage of primary care physicians and care providers. So nurse practitioners are in a really good place to help alleviate that.
And they can also prescribe medicine, right?
Right. So they in the state of Virginia, they practice under a physician supervision, but they can do all the things that your primary care physician can do. So if you go to your doctor and you have a sinus infection and they write you a prescription for amoxicillin, your nurse practitioner could do the same thing.
Now, you had mentioned about being required to have your bachelor's degree in nursing for most hospitals. That's, I guess, it's the standard now. Um, so explain to us what magnet status is, because I hear people talking about magnet status a lot, and I think our viewers may not know what that is.
So magnet is a credential that is given to hospitals. They have to meet certain requirements. They have to provide excellent patient care. Their nurses have to be happy. They have to have a good employee environment. So when hospitals meet these requirements, they send a team of, well, pre-COVID, they sent a team of people out to evaluate the hospital. They talk to nurses, they talk to physicians, they make sure that you're practicing at the top of the benchmark. And so as a patient, if you are interested in having surgery of some kind, or if you've just moved to an area and you need to find a place to receive healthcare, you can look up these hospitals. And if you're given the choice between a hospital that's magnet designated and a hospital that's not, you're probably going to choose the magnet hospital because you know that they're held to a higher standard than just your average hospital. So it's something really important for hospitals to work toward, being magnet designated. And part of that is being BSN certified. So having enough nurses in your institution with a BSN, because there's been a lot of research done that shows patients have better outcomes when you have a higher percentage of BSN nurses.
Okay. What are the different areas, and you may not name all of them, but what are the different areas of nursing within a hospital?
So the one that is probably most familiar to everyone is acute care. So general medicine, if you come into the hospital with an electrolyte imbalance or something and you don't require cardiac monitoring, you're going to go to a general medicine floor. And in that place, one nurse might have 4 or 5 patients. They need medical care, but they're not unstable. Another place is intensive care. So I have a background in intensive care. I worked there for a few years before I transferred to surgical services. A nurse there is taking care of critically ill patients. Usually it's 1 nurse to 2 patients. There's also numerous clinics you can work in. There's procedural areas where nurses do sedation. There's my favorite, surgical services, where you get to do a little bit of everything. Currently, I get patients ready for surgery and wake them up after surgery. You could work in an operating room as a circulating nurse. So you're kind of the boss of the room, making sure everything is done properly. There are also nurses who work in the OR who scrub in on surgeries. So that's kind of fun. In the hospital, just in the hospital, there's a million things nurses can do.
So you had mentioned earlier that there are nurse practitioners, nurse educators. What other type of jobs are there? So we're not really talking about wards or units, but what type of different nursing jobs are there?
You could be a bedside nurse, where you just take care of patients. You're physically there with them all the time. There's nurse educators who work in the hospital. So you are in charge of making sure that the nurses on your unit are educated on like new equipment and new practices and procedures. There are nurse educators for patients too. So like say you have diabetes, you're newly diagnosed and you don't know what to do. This is all brand new for you. There are people who are specifically trained to teach you how to take care of yourself. There are nurses in every place in the hospital. So I could go on for days about all of the different things you can do as a nurse. We have nurses who take care of us. So employee health has nurses who make sure that we are fitted for the proper masks to keep ourselves safe If we have an exposure to anything, they take care of us then too, making sure that we're safe and doing all the right things.
So for the person who wants to be a nurse, but they don't really want to work in a hospital setting, what type of jobs are outside of the industry, but that's in nursing, outside of hospitals, but that's still nursing?
As a brand new nurse, you're a little bit limited as far as that goes. Hospitals are always going to take you as a new nurse, but there are places like clinics, doctor's offices that would hire a new nurse that's not inside the hospital. Once you have a little bit of experience as a nurse, so say you went and worked on an acute care unit for a year or two, you could go and be a school nurse if taking care of kids is what you like, if you had some pediatric experience. You could work in a vaccination clinic. That's huge right now. You can work in a lab. You can work at home on the telephone where you don't have to interact with patients in person at all. There are also some insurance jobs you can do from home, making sure that insurance is covering the right things. So you can be a nurse. After you get some experience, you can be a nurse and not even interact with patients at all.
So there's a lot that a
A
nurse can
lot.
do, and that's good to know. There are also travel nurses, right?
Right. Travel nursing is huge, especially I'm sure everyone heard about travel nurses during the beginning of COVID who were going to New York to help care for COVID patients there. Most of the time you have to have a year or two of experience in some kind of area, whether it's just acute care or intensive care. You have some experience and then you can travel. So most of the time you get a 13-week assignment. They pay very well. They also pay for your housing while you're there. So
That's
that for someone who isn't really tied down is a great way to figure out where they want to be. You know, if you don't really know where you want to live or what hospital you want to work at, you can work for 13 weeks in any of them and try things out and see where you want to stay.
so you are a nurse and you are a nursing instructor. What attracted you to teach nursing at Pbcc?
Pvcc is where it all started for me. I became a student there when I was 17, and they gave
17.
me everything I needed to be a well-prepared nurse. I really enjoy the student population there. Adult learners are really fun. I feel like I was at Pvcc for so long that I became an adult learner. So I can definitely relate to any age student that I come across. I also really enjoy teaching people. It's so fun that I have all of the knowledge that the students are just dying for. They want to know what's all going on in here. So it's fun for me to be able to share all of that with them. And it's really exciting, especially teaching them things like skills, getting them through the scary part and seeing them be successful on the other side. It's very intimidating starting nursing school. So I like to be able to kind of ease that for them and try to make them comfortable and make everything relaxed so they can learn.
So you have experience as a nursing student at Pbcc and now as an instructor of nursing at Pbcc. So I know that you have a lot of good information that you can share with our visitors. One of the questions that I think they need to know is just how competitive is the nursing program at Pbcc?
Hugely competitive. So usually they get about 300 or so applications every year, and they take anywhere from 90 to 100 students a year. So you have to be the best of the best to get in. And I'm going to be very honest. It took me 3 tries to get into the nursing program at Pbcc. I was waitlisted 3 times, and mostly because I took on way more than I should have as I was taking my prerequisites. I worked full time. Sometimes I worked full time and part time. I just had way too much responsibility. So I wasn't able to dedicate the time that those classes needed to get the best grades possible. So I highly recommend making sure that you can put in adequate time for your courses. And if you can get A's in those classes, you're going to be in great shape. So if you're determined to get into the program on the first try, If you got A's in those classes, that's your only safe bet. The competitiveness is important. You know, these are people who are at some point going to be maybe taking care of you or your loved ones. You want the best of the best in this program, and it is a rigorous, intense program. So I understand why they only take the top.
So if you're waitlisted, what do you do while you're waiting or reapplying for the program the next year? I'm sure it can be disappointing,
Definitely.
but if you've done what you're supposed to do and you didn't get in, what do you need to do while you're waiting? You don't just wait and watch the clock. What do you do?
So for me, I still had some more classes I could take during the time I was waitlisted. And by the time I was waitlisted for the third time, I started to think, maybe I'm not supposed to do this. Maybe there's something else I need to do. So while I was working on figuring that out, I took some courses that I knew would transfer, because I knew I was going to have to get a BSN. So I took some courses at Piedmont that I knew would transfer to a BSN program, just so I could kind of be ahead of the game. But after being waitlisted the third time, about 10 days before classes started, I got a phone call saying that someone had dropped out and they wanted to know if I wanted a position in the nursing program. So I was right where I needed to be. I was ready to have to start that BSN once I graduated. I had taken all of my prerequisites, which is huge. I know that the credit course load for each semester with just the nursing courses doesn't show full-time, but it's full-time. It's full-time work for sure. So if you can have all of your prerequisites done before you start the program, you're going to be in much better shape, because I can't imagine adding, say, an English class or a science class to those nursing classes during the semester. They keep you full-time busy.
Now, I thought that most of the nursing students at Pbcc were adults, and maybe they are. You were 17 when you started. I mean, you were in the program at age 17, right?
No, I didn't get into the program until I was in my 20s. So I started taking my prerequisites at Piedmont right after I graduated from high school. So I probably took prerequisites for 2 years before I applied.
Okay, because I misunderstood, because I'm thinking, she must be a prodigy. You
No,
17.
Not even close.
The Doogie Howser of nursing. So what qualities help to make a good nurse?
You really have to be selfless. The majority of the things you do are about someone else. You have to put your own needs aside very often for the needs of someone else, which is not for everyone, for sure. You have to have a strong stomach. There are some things you're going to run across that not everyone is comfortable doing, and you just have to do them. Often you go a whole shift in some places with only having a snack and 1 pee break. So you just really have to be able to put yourself aside for your patients. And that's really hard. You have to get along as a team, definitely, because you're going to need every single person that works on a unit with you. Interacting with them properly is just as important as the way you interact with your patients. So definitely being a people person, I think, is a good quality.
I imagine you would have to think on your feet. You'd have to have a thick skin.
Definitely. Critical thinking is huge. Sometimes you might be the only person that's there with a patient who is, like we say, circling the drain. You have to think right now, what do I need to do to save this person's life? And that's hard for a lot of people. And that also comes with time. Being in the healthcare setting and getting comfortable with that is helpful for your critical thinking. Having thick skin is really important too, because, in a trauma situation where it's life and death for a patient, if the surgeon or the physician is shouting orders, you can't take that personally. It has to just roll off your back. You have to do what's best for the patient and move on, and know that they're doing this for the same reason you are. So they mean no harm to you. It's just they're making sure that the patient gets what they need.
I want to remind our viewers that if you have any questions or comments, please put them in the chat below. Leanne, what are clinicals and why are they important?
Clinicals are like the on-the-job training for nursing students. So you can learn everything you want to from a book, but you have to be able to apply it in a real life situation for it to be effective at all. So in a clinical, most of the time you start out in a long-term care setting. So you learn some of the like CNA type things, bathing a patient, making a bed, and you build upon those throughout your future clinicals. So being able to interact with people and do those really uncomfortable things with them is crucial to being a nurse. So it gives you a chance to kind of get your feet wet in the setting, get comfortable there, learn the things that you might be doing as a nurse and practice them on real people. Clinicals are I don't want to say more important than your coursework, but definitely equally important. You can't be a nurse if you can't function in the clinical setting.
So you mentioned sometimes in the clinicals you might have to bathe the patient. So that makes me think of CNAs. Is it important to have CNA experience, a clinical nursing, certified nursing assistant experience prior to becoming a nurse?
So it's not required. In my opinion, it is important. I don't know that I would have made it through the nursing program at Pbcc without my CNA experience. So I worked through all of my prerequisites as a CNA in the hospital. And the things I learned there were so helpful when I started clinicals. A lot of my classmates in my first clinical had no healthcare experience whatsoever. And some of them ended up dropping out because it just wasn't what they thought it would be. Having the CNA experience, just being comfortable on a hospital unit, knowing kind of where things are and how things work and how to speak to people in a healthcare setting was huge for me. And I was able to help a lot of my peers in our clinicals with that because I had that experience.
In a clinical setting, the student is being evaluated, right? You said it's like on-the-job training, but they're being evaluated because people are trying to determine if they want them on their team or if they have potential?
Oh, yeah. So as a nursing instructor, I'm evaluating my students during clinical. There are specific things that they have to be able to do in order to pass that clinical. But in any facility that we go to for a clinical, those people might be kind of side-eyeing you for future employment. And you the same way. You might be kind of feeling things out, just say, I really want to work as a CNA before I become a nurse, or I really think this is an area I want to work in as a nurse. So if you are functioning well in their setting, you probably have a much better chance of getting a job there than someone who they look at and they're like, goodness, she's been sitting all day on her phone and she's not, interacting with the patients at all. If you applied for a job there, they're probably not going to take you.
We have a few questions that are in the chat. One question is, did you have a CNA license to work in a related job while you were taking the prereqs?
I did. So I did CNA training in high school. So when I graduated from high school, I was a CNA. I started out in a nursing home here in town that I loved. It was wonderful. I spent a little over a year there, and knowing that I wanted to go to nursing school, I said, I really feel like I need more experience than just the long-term care stuff. So I went to UVA at that time, and I've worked there ever since.
Okay. I may be pronouncing this name incorrectly. This is from Yunki, and she says, I am from Tibet. I was a nurse in my country. I also graduated school. I also graduated school for my college as medical school, and I have had nursing license, which I got in my country. So my question is, if I want to continue my knowledge, what should I do? So I'm thinking that she Um, she went to medical school in Tibet, and she was a nurse, if I'm understanding this correctly. And if she wants to continue that career in the United States, what does she need to do?
I'm not sure about how like classes that you took in Tibet would maybe transfer to a school here, or if you would even need to do that. But I think at the very least, you probably have to sit for a state board of licensing to become a nurse here.
This question is from Abigail. Can you be competitive for PBCC's nursing program even without having CNA experience?
You can. So I'm not sure what this year's application looks like. I don't think that there's an essay question on there anymore. So you don't really have a way to sell yourself in an essay the way you used to. So they're looking at the number of courses you've completed, the grades you've gotten in those courses as like the top thing, and your TEAS test scores as well.
This question is from Milo. You may have answered part of this, but the questions are, what are the major differences between an RN to BSN program after already receiving an ADN compared to a traditional 3-year pathway to BSN?
So if given the choice, if I could go to either, I would definitely go for the BSN program because that's just straight through, you know, it's like a traditional degree, like 4-year school, go to school for 4 years, graduate, take your boards, become a nurse. With the associate's degree, you take prerequisites that are pretty heavy for the first year or two, and then it's a 2-year program. You graduate, take your boards, become a nurse, and then for me, it was an additional 2 years of coursework to get my BSN. So if you're able to do a traditional BSN program, that's your straight shot. If that's not an option for you, then definitely the RN to BSN is great.
This is a comment from Gigi Davis. Gigi is Pbcc's Job and Internship Coordinator. And she said, I've been told that having a CNA license benefits one's candidacy in Pbcc's nursing program application. But as you said, it's not a requirement. And so I guess what I would say to that is anything that you have in your experience, in your background that is related is going to be helpful. The more you have with good grades is better than having less with good grades.
Right. And even if it wasn't a consideration for candidacy at all, it's going to benefit you. It's going to be hugely helpful to at least have had a little bit of some kind of healthcare experience where you know a little bit about what's going on, you know how things work. That's one less thing that you have to get used to in a very stressful time of starting your first clinical.
Now we're going to talk about some things that you wish you had known prior to becoming a nursing student. And one of those questions that I have for you is, why are dosage calculations so important, and what are they?
So dosage calculation is what we have to do so say you're the physician and you order a medication and you want me to give 2.5 milliliters of it. And it only comes in a 10 milliliter vial. That's what the pharmacy brings me, 10 milliliters. So I have to set up an equation to be able to determine, and some of it's simple math, some of it really isn't. You really have to do the equation to figure out what the answer is. But to give the patient the appropriate amount of medication. And a lot of people will say, I don't need to learn that. I have a calculator on my phone. I'm always going to have a calculator with me. But being able to set up the problem is 3/4 of the battle with dosage calculation. So you could have 10 calculators. And if you don't know how to set up the problem appropriately, you're not going to get the right answer. And your patient could die from that. I mean, dosage calculation is a big deal.
And so as far as being in the program and staying in the program, speak from that angle.
Piedmont weighs very heavily with dosage calculation. So you currently get 2 tries. So you get a dosage calculation test at the beginning of your semester. I want to say they do the beginning of both fall semesters. You get a dosage calculation exam that you have to take, and you're able to miss 2 questions. If you miss more than 2 questions, you're going to have to retake that. And you get
How many questions total are there usually? If
10
you
or
miss
15. It's not a big exam. So in between those, your instructors will work with you to get some remediation and help you with the things that you maybe don't understand. But if you take that second test and you miss more than 2, then you risk being kicked out of the program. So you really have to make sure that you know your dosage calculations.
And when you were in the program, it was more strict, wasn't it?
It was. So we got 1 option to take the test. And if you missed more than 2, you were gone. And we lost people. There were people who failed out my first year, and you can only be readmitted to the program, I think, once. So not a lot of room for error there.
And it's really important because, like you said, a patient could die if they have the wrong dosage, which means health insurance premiums go up, there's liability, lawsuits.
Right.
So it is a really big deal. And I would think that you might not necessarily have time to punch numbers on a calculator. Let's say you're in ER and the doctor's shouting, give me 3 cc's of whatever. You need to be able to know
Quickly.
Yeah, so yeah, it's very, very important. What are some other things that you wish you had known?
I don't know that there's anything that I wish I had known that would have changed anything for me. I didn't know going into nursing school that being a nurse isn't really just your job ever. After you graduate, it's who you are. Your family and friends will call you all the time if they have an issue that they need advice on. I often threaten to bill my friends and family for all of their questions. But it really is just who you are as a person. You could stop working as a nurse and it's just always in you. You never get rid of it.
One of the questions that students ask me is, who should I use as a reference? I don't know who to use as a reference. And I always tell them to start with their nursing instructors or
Definitely.
instructors.
So if you had a nursing instructor for a clinical, who better to speak on your clinical practice than them? So make sure you do well in your clinicals and you'll have plenty of references.
And another question it's more of a fear, they will say, oh my gosh, but no one's going to hire me. I don't have any experience. And I always say, well, they know you don't have any experience, but you have gone through the course, hopefully passed the NCLEX, and you have clinical experience. And it's the clinical experience that they want to see on your resume. The
Right.
clinical experience is key. Would you say?
I totally agree. And they know that you're coming in as a brand new nurse. They're not going to expect things of you that you don't have. They know that you have the knowledge. You're going to be assigned a preceptor, which is a nurse who already works there, who will work closely with you for a designated period of time. In acute care, usually it's like 3 months. In intensive care, it's 5 or 6 months. Procedural areas can be different than that too. But you're going to have someone who's there to make sure that you know how to safely care for your patients. At UVA, we have nurse residency. So when you start here as a brand new grad, you go to these nurse residency things once a month where they try to make sure that you're getting what you need on your unit. And if you're not, they'll work with you to figure out what that is. You do a lot of learning. So your learning does not stop when you graduate from nursing school. When you start a new job, there will be tons of classes they'll send you to for things that are specific to that area. So even with no experience, they'll take you because they're going to give you everything you need when you get there.
Okay, I have some more questions from the chat.
All right.
This question is from Catherine. Is the amount of time a candidate has had a CNA license also considered for their application?
I'm not 100% sure about that. Um, that would probably be a good question for an advisor at PVCC. They change every year a little bit, kind of what they look at on the applications. I think probably just the fact that you have that license is a good thing, and that maybe you've worked with that license. I don't know that they take into consideration whether you've done it for 2 years or 10.
Okay. Another question. Let's see. Actually, this is a comment from Gigi. I thought I would point out that UVA is doing a lot of hiring of access associates, health unit coordinators or HUCs, patient companions, sterile processing technicians, and other positions, which are great entry-level healthcare positions that pay $13 to $15 an hour, depending upon the type of position. And we send out a weekly e-newsletter to our students, so that information is in the most recent issue of that newsletter.
And those roles are definitely great for experience too. And one thing that I will say is, in coming to work at UVA, after I worked here for 6 months, they started paying for a lot of my tuition. So if you can get your foot in the door here, or really any place, I'm sure they have tuition assistance programs, but UVA's is really awesome. They've spent a ton of money on me in my school career. And also, being an employee here, it was really easy for me to get a job as a brand new nurse. Some of my colleagues who didn't work here struggled when we first graduated to get jobs here. Some of them had to go elsewhere for a year before they could come here. So if you can get your foot in the door before you graduate, it's definitely going to help you.
That's really, really good advice. Have another question. This is from Tiara. Is there a class you take for that, or do you learn that in the program?
Oh, I think that's about the dosage calculation.
Yeah,
There is a class that you can take, and I think they do it the summer prior to when you start classes in the fall. And I think it's an online class where they teach you all of the dosage calculation stuff. And there's also, as a part of your first lab, there's a lot of dosage calculation work too. So you're not expected to know those things when you start.
Leanne, what are some of the challenges facing the nursing industry today?
Definitely a shortage of nurses. So the rate at which older nurses are retiring is faster than what we're receiving new nurses. And I think a lot of that is due to a inadequacy in nurse educators. We don't have enough. So we're not able to turn out the number of new nurses that we need to replace the ones that are retiring. So that definitely makes things difficult. Also with the coronavirus pandemic right now, things like PPE shortages they're real. You know, we're fortunate at UVA. I haven't once had to look for something that I needed that we didn't have, but that's real for a lot of places, the PPE shortage and the potential for exposure. You know, you keep yourself as safe as possible, but there's always the potential that you get exposed to something at work.
And so I might add that, like you said, there's a great demand for nurses. And nursing is a career that's portable. I mean, you can pretty much take it anywhere you want, right?
Right. Any place you go, aside from maybe California, nurses have a hard time finding jobs out there because there's a lot of them. Any place you go, really, you're going to be able to find a job as a nurse. There's always a need for nurses.
Okay, so there are 49 states, but not California necessarily. Okay.
Yeah. Maybe after you get some experience, it wouldn't be hard to get a job in California. But as a brand new nurse, it's difficult.
Okay. How do you believe you are making a difference in the nursing profession?
For my patients, definitely when they come in for surgery and they're absolutely terrified and I'm able to send them to the operating room feeling better and they're thanking me for helping them relax and educating them on what's coming next, that's good for me. I definitely feel like I'm making a difference in their lives. For my students, helping to talk them off the ledge a little bit when they're really wound up about tests or things that they need to learn that they're struggling with, I really enjoy being able to look at them and say, look, I did this. You can do this. You're going to get through this. It's going to be fine. And helping to find the resources that they need to be successful.
I think also because you were waitlisted 2 or 3 times, you have credibility when you're talking to students who are having a difficult time as well.
Definitely. You have to be persistent. If you know that this is what you want, don't give up. I see a lot of people that I started at Pvcc with when I was working on my prerequisites. Everybody started wanting to be a nurse, and out of all those people, a fraction stuck it out and did it. Things happen along the way, life, jobs, families, children, and all of that. But if it's what you really want, don't give up.
Awesome. Now, once you become a nurse, you have to have continuing education or do something to stay current in the profession. So what do you do to stay current?
The hospital is really good about giving us resources to fund education things. We have memberships to all kinds of journals and online resources to educate ourselves. There's conferences you can go to as a part of your specialty that will give you all of the continuing education hours you can stand. So as a nurse in Virginia, you're required to have continuing education to renew your license every 2 years. It's minimal, it's 15 to 20 hours. As a certified nurse, every 3 years when you recertify, for me, it's 90 hours with my peri-anesthesia certification. So between conferences and online resources and reading journal articles, you can easily get all of those hours.
You know, years ago, I used to hire nurses when I worked in human resources at UVA, and I know that there is a board of nursing. What are some things that can cause a person to have their license revoked?
Diversion of drugs is a good example. People with substance abuse problems can become nurses, or nurses can become people with substance abuse problems. And so that's one thing I can think of where you may lose your license for. Some kind of malpractice that resulted in a bad outcome for a patient may also be something you could lose your license for.
Yeah, I did have a few people who had their license revoked, and they had applied, and there were a lot of steps that were involved. Tell us something about the shifts that nurses might have to work, especially a new nurse.
As a new nurse, if you are working in an inpatient setting, so acute care, intensive care, most of the time you work 12-hour shifts. I feel like the vast majority of nurses work 3/12s. So that sounds like, oh, nice, you only work 3 days a week. It doesn't feel like you only work 3 days a week. But so those 3/12s might be days or nights. They might be rotating, which is really hard. But as a new nurse, that's kind of what you get. So once you're able to spend some time in a place and develop some seniority, you may be able to then move up to where you only work days, or if nights is what you enjoy, then you could only work nights.
Did you have to ever pull that type of shift, the 3/12s?
I did. So while I was a CNA and while I was a nurse in intensive care, I worked 3 12-hour shifts. For a long time, I worked all nights because I really liked it. When I came to surgical services, it was because I wanted better work-life balance. I wanted to be able to sleep at night again. So currently I work 4 10-hour shifts. Some of my colleagues work 5 8-hour shifts. Some of them work part-time and, maybe only work 3 8-hour shifts. So there's a vast majority of schedules. They're all so different across the health system.
So if you're working 3 12-hour shifts, what advice do you have for someone who's getting fatigued? Are there strategies, tips that you use to keep
Definitely. Blackout curtains. If you have to work night shift, you have to have blackout curtains.
What is a blackout curtain?
So they are super thick curtains that you hang on your windows, and it looks like night in your bedroom in the middle of the day. That was,
Really?
yeah, that was the only thing that helped me on night shift to be able to sleep during the day. Doing things that are conducive to sleep, like toward the end of your shift, maybe like herbal teas and things, or wearing your sunglasses home so that sunshine isn't shining directly in your eyes while you're driving home, because that, makes you want to wake up. Making your bedroom a place where that's conducive to sleep, staying away from your devices, all of those things that they talk about with helping you go to sleep at night can also help you go to sleep during the day. Making sure that you take time for yourself. This hasn't always been a big thing in nursing, but self-care is huge, and I'm glad that it has expanded into the nursing profession lately. There's a lot of self-scheduling that goes on some units. So maybe it's best for you if you schedule your 312s all in a row to knock them out, and then you have, an adequate amount of time off. Maybe you find it's better if you work every other 12-hour shift so you can get adequate rest. You really just have to figure out what is best for you and your life.
Have another question. This question is from Stephanie, and she says, I hear nursing is popular for career changers. I've been taking Pvcc for 2 years now, and I'm planning to apply to nursing programs for next year. Is there a disadvantage or advantage to being an older nursing student, late 30s to early 40s?
When I was in the nursing program, I went to school with probably more people who were over 40 or 50 than I did people who were my age. I don't think there's any disadvantage at all. Sometimes newer technologies are a little difficult for people who haven't been immersed in it their whole life. Like, when you're currently 18 years old, technology is all you know. If you're someone who's 60, it might be newer to you. I don't think there's a disadvantage at all. Probably an advantage because you have some life experience. You know yourself. You know how studying works best for you. Maybe you're at a place in your life where you're able to dedicate the time that those classes need. So there are some advantages, but I can't think of any disadvantage to being an adult student.
And Stephanie, I would say that that age group is probably the norm, and you're really in good company. And what I've noticed is that the younger, more traditional students tend to help the older students with some of the technology issues. And like Leanne said, the older students with the life experience are able to help those younger students navigate life.
Yeah, definitely. They both give something to each other. One of the best friends that I made in nursing school, I actually went to elementary school with her son. Elementary school through middle school, we went to school together, and then I was in nursing school with his mom. And her life experience was so helpful for me.
Absolutely. I want our viewers to add any more comments or questions that you have, because we're drawing toward the end and we'd like to get all of these questions and comments in. Tell us, Leanne, what challenges do you face as a nurse?
In my own practice, staffing is always a challenge. It's like, I call it like herding goats. As soon as you think you've got them all, then one wanders off. Definitely the pandemic is something that I had never thought about in my career before, but in the beginning of this, when we didn't really know what was going on and everyone I knew was working from home, it scared me a lot coming to work every day because I didn't know what was going to happen. I didn't know, if I was going to come in contact with coronavirus just on one of my regular shifts while everyone else seemed like they were safe at home. So something to think about for sure going into nursing is that Those things don't have an impact on us. We still come to work every day. We still have patients to care for. That never changed. And one of the big difficulties now is bringing patients into the hospital who can't bring a family member with them. That's so hard for them. So we're taking a lot of extra steps to make sure that these surgery post-op patients go home with someone who knows all the things they need to know. We do a lot of educating them over the telephone. Just a lot of, going above and beyond to make sure that these people are comfortable going home because they can't be here like they used to.
And I think it's also important to realize that you guys are on the front line. You are first responders in many cases, and it doesn't matter if it's a pandemic, if it's an emergency. You see people who are injured, you see people who are dying. You establish relationships with people, and some of them die. And those are issues that I think everyone needs to be aware of as well.
Definitely. Things don't ever stop here. Snow, if you're just not feeling good, there are jobs where if you wake up in the morning and you don't feel great, you can just stay at home, and nursing isn't really one of them. Certainly if you're contagious or something, you have to stay at home, but your team relies on you. So whether it's a pandemic or a blizzard, you're still coming to work. And it's easy to get attached to patients because you spend so much time with them. If you work 3 12-hour shifts in a row and you take care of the same group of patients, you know more about them by the end of your 3-day stretch than you do about some of your friends. And when something goes wrong with them, I think it's normal to feel upset, but it's hard for us because we want to be strong. What makes us good nurses is also what makes us feel like bad nurses, because you feel like if I'm so devastated over the loss of this patient, I'm doing something wrong. That's actually what makes you good at your job.
Absolutely, absolutely. I have 2 more questions. This is from Gigi. First a comment and then a question. I've had some of the older students not realize the physical demands of the job. Could you talk about that? How much standing, lifting is involved?
I think that's so different in every practice setting, but definitely every place I've worked, standing is huge. You rarely sit down. So for someone who is physically compromised, that's going to be very difficult. In working in acute care and intensive care, lifting is huge. You might have a patient who weighs 300 or 400 pounds, and the staff, you have to turn them every 2 hours to relieve pressure on their back. You have to be able to help them into a chair when they can't get there themselves. And definitely there's assistive devices that do a lot of the work. But I would say if you're unable to lift at all, it's going to be very hard for you as a nurse. Once you get a little bit of experience, then certainly there are jobs that are not as physically demanding, things on the telephone, working at a desk. But as a brand new nurse, you definitely have physical demands that you have to meet.
I was told that years ago, male nurses were in demand. Is that still true?
I don't know if there's a higher demand for male nurses. I appreciate working with a combination of male and female nurses. I think we just bring different things to the table. And it's nice when you have to perform a procedure on a man, often they're more comfortable with another man doing that. And the same vice versa. If you have to put a Foley catheter in a woman as a male nurse, she might not be super comfortable with that. So it's always nice to have a little bit of both.
Okay. And if a person speaks more than one language, how is that beneficial?
Hugely beneficial. So I only speak English. If I get a patient who speaks another language, I have to use an interpreter phone, or we even have an iPad that you can use a live interpreter with. But sometimes it's hard to get those things. And so if I'm able to speak another language, it's so helpful to all the staff. People will utilize you as much as you are willing to be utilized to help translate.
Okay. This question is from Abigail. Is there a certain specialty that is better for new nurses to work in to gain experience after graduating?
I definitely think general medicine, acute care, or intensive care are great places to start because you get a really well-rounded experience. You see a little bit of everything. If you start out in a specialty area like maybe labor and delivery, um, you're kind of limiting yourself to that. If you think about it, like if I go work in general medicine, I see a little bit of everything. In a couple years, I can go anywhere. If you start out in a place that's so specialized, like a labor and delivery, it's going to be hard for you to transfer elsewhere without like a full-on brand new nurse orientation because you haven't seen any of those things.
This question is from Brianna. If you do not have a CNA license and you plan on applying to the nursing program at Pbcc, what are some things I should participate in, activities to do to prepare myself for the nursing program?
Pre-COVID, there were a lot of things you could do to volunteer, which I would say would be helpful. Things like health fairs where you could just be the person who's asking patients questions, helping them fill out questionnaires, but you just get a feel for interacting with people. I think that's anything you can do to interact with people is going to be helpful to you in the nursing program. And anything you can do online, reading about different medical things, maybe subscribing to like a nursing journal where you might not know exactly what you're reading about, but that would give you something to be able to research and look up to learn about different things that nurses are experiencing.
Okay. There are also opportunities on Pbcc's volunteering page, and that link is provided in the chat. And I want to remind our viewers, if you are Pbcc students, please contact Career Services for assistance in writing your resume or with the job search, or help with putting together your list of references or your cover letter. That's what we're there for, to assist you, because we are interested in your job search success and your career success. So before we wrap up, Leanne, is there anything else that you would like to share with our viewers, tips or anything that you think that they might need to know?
One thing I think people may not know going into the program is to try to work full-time and be in this nursing program is almost impossible. I'm sure there are people who have done it. They would probably tell you that it was miserable. Just try to be able to work less while you're in the program. Set yourself up to where you're not so financially extended that you have to work full-time. You will thank yourself later. Having the time to dedicate to those courses is going to make all the difference for you, especially if you're doing prerequisites now in preparation for applying to the nursing program. And the heavy course load that those nursing courses give you is just not, it doesn't pair well with working 40 hours a week. So be prepared to have to decrease your work hours if you plan to work while you're in the program. And definitely utilize every resource you can find. The people that you end up in the nursing program with end up being like your family because you spend so much time together and you almost feel like you've gone through a traumatic event together because it's so rigorous and intense for those 2 years. So utilize the people around you, ask all the questions you can think of, and don't give up because you'll get there.
And Leanne, if you are in a full-time nursing program and you have a family, you may have to help prepare that family for your absences or for the fact that you need to devote time doing nursing as opposed to family time.
Definitely. So make sure you set aside time for your family, but you're also going to have to let them know that sometimes I'm going to have to be gone, or sometimes I'm going to have to be at this computer and I need you to not bother me. I remember in one of my first nursing classes, they were talking about things you could do to help alleviate some of the stresses at home while you're in nursing school. And one student said, we're going to eat on paper plates until I graduate because I'm not washing dishes the whole time I'm in this program because I just have so much else to do. I think while you're in the program, you find little things like that, like, I just have to let this go because I don't have time. Either someone else is going to have to do it or it's not going to get done. And it's okay. Your family will understand. And at the end of it, you'll all be better.
And if your children are old enough, you may be able to help them to understand, I'm doing this for you, and you're setting a example for them as well. And so that later on in life, when they're in school and they're struggling, I can say, if mama could do it or dad could do it, you can do it too.
Definitely. I think that's probably the hardest thing for adult learners is that you often have to balance your school life with your family life a little more than maybe the traditional, started college when I was 18 years old kind of student does. But it all works out. So don't stress over the little things. If you end up with a sink full of dishes, it's totally fine. Someone will get the laundry if you have to live out of the piles for a little bit. I always felt like when I got to the point that it was like, okay, it's too much. I'm getting stressed out. The house is a wreck. I have homework to do. Then the semester would end and I would have a little reprieve. And I would get everything straight and then the semester would start again. And by the end of that 2 years, I was like, I don't have any more patience. I don't have any more money. I am mentally exhausted, but it's over. And they keep you so busy that it flies by.
Yeah, it's not a life sentence. It is.
No, it's short-lived and you can do it.
Absolutely. Leanne, thank you so much for being on our Career Chat Spotlight today.
Yes, thank you for having me.
Oh, it's just been wonderful. You've just given such great advice, tips that I'm sure that our viewers are very, very happy to have received. And to our viewers, I just want to thank you for participating in the chat and for just joining us in this career chat. And as a reminder, this career chat has been recorded and it will appear in the Pbcc Career Services YouTube page.
And I'm happy to answer any questions. If you guys are looking at this later on down the road, feel free to email me, ldavis@pvcc.edu. I'm happy to answer any questions that you have about the nursing program.
That is wonderful. Spoken like a true instructor.
We can never turn it off.
Exactly. Thank you, Leanne. Thank you, viewers. We will